back to Nubian Tigers Talk. I'm Ray Smaltz. I'm with my co-host Michelle Jacobs, and this is part 2 of our interview with Dr. Cheryl Holder of Florida International University as we conclude our conversation on environmental racism and health outcomes. So, Cheryl, I have a question about scientists and physicians that are on retainer to these large corporations and companies that are the ones that come back and say, oh, well, there's not a large enough amount of a toxin to affect anyone. How culpable are they in terms of the amount of oppression and racism that is thrust upon Black and brown communities? I mean, supposedly they take oaths and stuff like that, but the dollar is a lot larger than any oath that they'll ever be able to sit down and take.
Yeah, we've gone through this. The history of medicine is filled with this problem, and it's been accepted, and they have enough studies that they feel good about, because you know how science works. I mean, we can't absolutely prove something to be absolutely correct, but we can sort of disprove other things. So we can always feel comfortable, if that's where you're inclined to believe, that this amount of exposure isn't so bad. And especially if the person dies from something else, then they're easy to say, well, it didn't cause any death, they died from XYZ. So I don't think these scientists particularly feel culpable because they do feel comfortable with the science. Now, there's some, like with the climate issue and fossil fuel and global warming, now they're those that are just on the take. And I think it's consistent now that there's no scientist who has any degree of wanting a reputation and maintaining it will come out and do that. Because not that they really care about one way or the other, but their reputation will be harmed. And also we know that the fossil fuel industry is dying as it is. Oil will have to be, there's some point it's going to end. Unless we come up with some magical engineering feat, oil is gone. So like anyone, these groups are going to find a way to repair their image and move on to the next moneymaker. But every industry, every group, every profession has its people like that. And so medicine is no different. Unfortunately, you wish it were so, but I think our history of medicine, especially if it's treated Black people and brown people, has been filled with evidence that shows that you will find ways to justify whatever it is you want to justify.
Yeah, I'm just thinking back to the Black female physician that died after she contracted COVID, and she was trying to tell the treating medical people, I am a physician. I know what I'm talking about.
Yes.
Right?
Yes, she was all over Facebook, and she posted that to Facebook. It was awful. I don't know if you watched it.
Dr. Suzanne Moore.
Yes.
Yes.
Very sad. And it was evident to all of us, everything she told them, she just didn't get the best quality care. But that's been proven also. Institute of Medicine back, I believe, 30 years ago had the data showing that racism is causing so much deaths. And as a profession, we have to come to terms with this and do something. And we've specifically said, do not do studies to prove that you are not racist.
Yes.
That's what a lot of doctors and companies and people will do. Let's study this problem. Are we really? The Institute of Medicine says it is here, it is what we do, it is structural. We all have biases, and especially medicine, and we must do something. Now, what that something is still hasn't been pointed out well. But I think coronavirus has pushed us to understand when we talk about equity better. Because when I look at coronavirus, especially this vaccine distribution, they didn't care about the death. And you could see, 400,000, and everybody is still running around, not wearing masks, not doing anything, because they weren't dying. But now when we look at the vaccine distribution, when we talk about equity, it does matter that we find equitable distribution, because all of us will be impacted, whether you're rich or poor, black or white. Because if you only immunize the rich people and the black folks and brown folks continue to get infections, you're going to get more mutations. And as you get more mutations, you may get a variant that your vaccine that you rushed to get because the structures allowed you to get it first doesn't mean a thing.
Right.
Mm.
Right.
So when I tell folks, this is what we talk about, equitable distribution saves all of us. We're not asking for special treatment, but equity is the only way. That you have to look at what are the barriers to a group of people not getting the care. Because if we had had universal care way back, we could have had a distribution system where we identify the doctors and give them the vaccines and we'd have all gotten it.
Right. Right.
Mm-hmm.
I saw something on Black Twitter recently that said, you know, the government spent November, December, and January talking about how the Black community is vaccine hesitant. And then they didn't make any plan whatsoever to distribute vaccine to
Plan?
the community, right?
You want a plan as well?
Right. So I think the
Yeah.
New York numbers are New York and DC. I'll say the Northeast corridor. Only 5%
Yes.
of African Americans have actually received the vaccine. So,
That's right.
Down in Florida, they did it. It was all the rich communities who got it. And the communities who said it was a hoax got it. And everybody else still waiting. Because
right.
the distribution plan was built on a plan was already structurally racist. Hospitals are not in Black communities. The store that they selected in Florida has no branch, no stores in Black communities.
Yeah, Publix.
Or Publix, none in the poor communities.
I mean, a lot of Black communities barely have an urgent care center that you can even go to.
Yeah.
And they wouldn't be the first ones to receive any vaccines at all.
Right. I think
Yeah.
Cori Bush said one of her first appearances in DC said, well, you know, you tell people to ask their doctor, but for many of our people, they don't have a
They
doctor.
don't have, yeah.
Right.
Florida
So-
did not expand Medicaid.
Right.
Right.
A lot of working older people have no doctors, have no health care.
Well, most of the states in the South didn't accept the Medicaid
Expansion.
exemption. Yep.
Yeah, even when the first 5 years was covered. So it was just in straight out uncaring decision.
Yeah, you know, I've said to people, sometimes I teach international law, and if we were a developing nation, we would be, if we were a developing nation, people in Europe would be pointing at us and saying there's genocide going on there,
Yep,
right? It's genocide.
I
But
agree.
because we're a developed nation, no one is pointing, they're just going, oh, this is a catastrophe. Look at what's happening in the US. No, it's genocide.
Yeah,
Genocide.
you
Yeah.
have a point. The professor and I, Weissman, we put in a paper looking at this coronavirus epidemic and our civil rights and the whole concept of disparate impact. That if you're aware of a decision that is impacting the population, no matter how your intentions are, and it leads to unnecessary deaths, is that a violation of that population's civil rights?
Mhm.
So when you look at coronavirus and the decisions that are being made, you know there's a population with no healthcare. You know there's a population that's sicker. How did you just make these decisions that you know is going to lead to more death? And could this be, and especially when you look at distribution of allocation of resources, we looked at there's a guidelines that you use for very ill people in the ICU. And those guidelines were based on criteria that gives you a score. And this score came out of how good is your heart, how good is your lungs, how good are your kidneys, how good is your brain. Now you already know many of us, rich, poor, whatever, live in polluted environments, so our lungs are not going to be as good. Our kidney function tends to be worse for several reasons, but one of the reasons is that they use a scoring and an evaluation of the kidney function early in disease that said Black kidneys were better than the score because Blacks supposedly had more muscle. And so we were supposedly putting out more protein. But when you look at the studies, there weren't that many Blacks in the studies. And who really is Black?
Mm.
So how did they define that these Black folks really had so much muscle that the few Blacks that they had in the study could now speak for 13 million people? Now, those 13 million people are left with a kidney function test that overestimates the function. So when they get, the kidney really gets bad, it's so late that you end up not doing well and end up on dialysis. So when coronavirus comes around, you got bad lungs, bad kidneys. So if there's a ventilator or a treatment, you're not going to be on that list. Same thing with the distribution of vaccines. So is this really, like you said, I don't know genocide, but is this really a civil rights issue that, and with medicine, healthcare is not a constitutional right,
Right, correct.
but are we violating our civil rights by the decisions that our government's making? So these are huge things that we have to address as a community, because with coronavirus, you only take care of one group, you are not protecting yourself, as the other group may get that mutant variant.
Right, as we can see,
African,
Brazil, right?
South Africa. Right.
Mm-hmm.
We're one world community.
Yes,
So when those variants hit us, and we could create one in South Florida if we don't find a way to control and give care and protect the poor communities so they're not getting the replication, because viruses don't care.
right. They just
Dr.
need a
Holder,
host.
can the, I'm sorry, Michelle, I apologize.
No, I was just saying they just need a host. They don't
They
care.
just need a host. Exactly.
This.
They don't care.
Dr. Holder, in your opinion, we know what the government has done and politicians. Can the medical community do more to protect Black and brown communities, serve Black and brown communities better? And are those, real, are those real ideals, or are we, is it just fantasy?
I think the intentions are always good for the most majority. The New England Journal came out and actually, for the first time in its entire history, supported Biden. They were very much anti what has happened with the previous administration. You don't see very much in the majority. In the National Medical Association, our history has always been to advocate for the poor. We were the only health society that supported Medicare, the only group that supported Medicare. So the history of medicine has never been to advocate consistently for the vulnerable communities, because Medicare was only National Medical Association. Medicine has changed even more, where it is now controlled by the bigger entities. And again, there are only 1 million doctors about. There are only about 50-something thousand Black physicians. So our voice will never be able to counteract what we see. Now, we can educate, we can support, but the reality is the numbers are not there. So the community, I think AMA, everyone has always come across and said now they support universal health care. Pretty much most of the large organization in medicine. But do we have the power to make the change? I don't see it. I may be more pessimistic than most, but I don't see it because we just don't have the numbers. And also, medicine has changed tremendously. Most doctors are no longer their own little entity. Most are employed, and employed physicians. If you look, there's a doctor who when they're giving out the vaccines, I forget what state he was in. He made the call, rather than waste a vaccine, he would just give the extra, give the doses to whoever was there. A proper ethical medical decision. He was terminated.
Right. I think it was Idaho.
Idaho, right.
Crazy.
I've known people who were in Chicago and they said their supervisor said, toss it. They wouldn't take the chance of giving those vaccines because they didn't want to lose their jobs. So when these basic decisions that are coming through that make sense ethically, and it also makes sense medically, because more vaccines in people, the better we have a chance of getting ahead of this virus before the mutant strain shows up. So the physician is making, rather than waste it, put it in somebody because that's less transmission.
Right.
But he was terminated.
Mm.
So we are not our own boss for most of the time. And the young docs coming in are up against an even bigger challenge than the docs my generation. So I think we can ethically and speak up what we say is correct, but many doctors are silenced.
So this has been a fascinating conversation, and let me just wrap it up by asking you something that I didn't tell you I was going to ask you. I'm curious to see what you think. Should we be hopeful about the new administration, and will that help contribute to a better health equity situation for all of us?
Oh, absolutely. I think we should be. If you look at the team that he's put together, amazing scientists, amazing doctors. And his message has also been appropriate, where he's talked about equity, he's talked about racism, he's accepted their structural racism. What I hope he takes it to the next level is that changing this, it's not about affirmative action. It's not simply about righting a wrong, that for our society, it is best for all of us. Because coronavirus has pointed out that an equitable response, giving people what they need, bringing the health of everyone up, benefits our entire society.
Right.
You as a white person should be just as vested in my health as I am in your health. It's going to benefit your health and my health and benefit our community. Coronavirus is showing this to us. Climate change is another big pandemic that's coming that's going to test us.
Right.
And so you can't save one group of folks and think you're going to save yourself. It's just not going to happen. So I hope his team in climate is amazing. The teams everywhere that he's put together and the words, but where I see it is that the society, the voters must hold them accountable.
Right.
And so it's not so much about Biden. I talk to young people and I say, listen, millennials, Gen Zs, everybody, you guys had better vote and hold these politicians accountable.
Right.
And it's not about whether he wants to do it or not. He will do it because politicians will do what you want because you're going to vote. As soon as they know that, it's going to happen. Now, there's Dr. Simpson. He's a 95-year-old surgeon down here, oldest Black surgeon, and he's still with it. And he says, well, Cheryl, until Black folks have at least 20% of the vote, we will be marginalized. So the goal is make sure your coalition get minimum 20%, can have some clout. Lowe talks about Blacks moving back to the South to take over some states so that they can control the vote. But mathematically, it's about getting 20% of your group to really have a clout in the vote. And any politician will do what you want them to do. I don't care what Biden thinks, Biden will say what you want to say because they want to maintain power.
Well, Dr. Cheryl Holder, thank you very much for being on the show. You are carrying forward the Tiger tradition of being just fantastic. And thank you so much for being willing to spend some time with us. And I'm sure in the future we'll be looking for you again.
Thank you. It's a pleasure talking to you. And go Tigers.
Go Tigers.
And Michelle, I really look forward to our next show because it's going to deal with heirs property, which is a subject that I've always wanted to find out more about.
Right. And a lot of us don't know about heirs property, Ray, but it's an issue that prevents a lot of Black families, particularly those who have roots in the South, from retaining long-term family held land. So I'm very much looking forward to hearing Dr. Thompson talk about that next week.
I look forward to it as well, Michelle.
If you enjoyed what you heard today, visit our website, NubianTigersPodcast.com. In addition to the podcast, we also post a resource page for each subject to provide additional sources of information. Follow us on Twitter. Our handle is @NubianTigers, written as one word. We're on YouTube on the Nubian Tigers podcast channel. Have a favorite podcast service? Well, we're probably on it. So just subscribe and look for us under Nubian Tigers Talk. Looking forward to sharing some knowledge with you next time.
Wake up, wake up, wake up.